So we're going to be doing joint mobs today. We're going to be doing grades 1 through 4 on the knee, the second MCP joint, and the shoulder. So first off, we're going to go with the knee. So I'll move us through some anterior and posterior glides. We're going to distract, and it's easier to distract and hold down with your leg. Hand placement, I'm going to put it right there on the joint line. For the grade 1, it'll be small oscillations at the beginning of joint play. This is to relieve pain. For grade 2, go about midway through that joint play, and again, small oscillations for pain control. Grade 3 is from end to end. This is to increase range of motion. And grade 4, you're going to bring them all the way to their end, range of motion, and hit those small oscillations again for range of motion increase. And you'll do that usually 3 sets for 30-second repetition intervals. If you want to put your hand on your knee like this for me, and relax. So the second MCP joint is obviously a lot smaller, so hand placement and whatnot will be a little bit different. So for grade 1, we're going to do those small oscillations. Grade 2, we'll take about midway through the joint play. Small oscillations again. Grade 3 will be those end-to-end slow oscillations. And grade 4 will be the end of joint play with small oscillations. Now, to compare these two, the knee, the tibiofemoral joint, compared to the second MCP joint, obviously your fingers are a lot smaller than your knee is. Excuse me. So you're going to have to use a lot more force to move the bones and to move the ligament, to get that capsule moving, as opposed to the finger and the second MCP joint. And the motions, you'll see it'll feel a lot easier to move. The motions will be more distinct in the finger than you would in the knee. Go ahead and lay down your back for me. This way, please.
Is that not right?
No, that's
okay.
And come to me as far as you can. We're going to do the shoulder. So, go ahead and just put your armpit. Again, I'm going to stabilize here on the shoulder, grabber on the humerus, and we're going to do the small oscillations at the beginning of joint play. This is again for pain control. For grade 2, we're going to get her at the middle of joint play, hit those oscillations again. This is again for pain control. For grade 3, we're going to hit end to end. This is to increase range of motion. And finally, grade 4, bring her to the end range of motion or the end joint play and do those small oscillations. And with Cole here, the shoulder is a lot more loose, which it should be most people, than the knee is. So you'll get that easier oscillation feel, I guess, like the easier range of motion. And but the finger, of course, is the easiest because you only have to use your fingers to move your finger. The range of motion and the movement in the shoulder were a lot more noticeable, I think, than the knee. It's a lot easier to move them. The force required to move the shoulder was less than the knee, but higher than the finger, and that's about it.